Welcome to UMCC Medical Consultant Connectors, where your health matters us. A fracture happens when a bone breaks. An open fracture is a specific type of fracture. It's also known as a compound fracture. Open fractures are serious injuries. They happen when the broken bone punctures the skin. This creates an open wound. This wound makes the fracture more vulnerable to infection. Open fractures range in severity. They are classified by the severity of the bone break and the damage to surrounding tissues. A minor open fracture might involve a small break. It might have a small wound. A severe open fracture could involve a shattered bone and a large deep wound. These fractures require immediate medical attention. Prompt treatment minimizes the risk of complications. These complications include infection and long-term disability. Understanding the causes, symptoms, and treatment of open fractures can help us respond effectively to these emergencies. Open fractures are often caused by high-energy impacts. These impacts are strong forces. They are strong enough to break a bone and push it through the skin. Car accidents are a frequent cause of these types of fractures. The force of a collision can cause severe injuries. Falls from heights can also lead to open fractures. The impact with the ground can be substantial. Other incidents that can result in open fractures include motorcycle accidents. The speed and lack of protection make riders vulnerable. Gunshot wounds. The high velocity of bullets inflicts significant damage. Industrial accidents, heavy machinery and equipment pose risks. Violent assaults, physical altercations can lead to these injuries. These situations often involve multiple injuries. This complicates diagnosis and treatment. Understanding the potential causes of open fractures underscores the importance of safety measures. Wearing seatbelts, using fall protection, and promoting workplace safety can help prevent these traumatic injuries. Open fractures present a clear and alarming sight. A broken bone is visible through a wound. This is a key characteristic of this type of fracture. The area around the injury will be swollen and bruised. Intense pain is another immediate symptom. The pain is often exacerbated by movement. Other symptoms might include bleeding from the wound. The amount of bleeding can vary, numbness or tingling. This may indicate nerve damage. Difficulty moving the limb. This is due to pain and instability. Bone fragments visible in the wound. In severe cases, if you suspect an open fracture, it's crucial to seek immediate medical attention. Do not attempt to push the bone back in. Cover the wound with a clean dressing. Control bleeding by applying pressure around the injury. Keep the injured limb immobilized. These steps can help minimize further damage while waiting for medical professionals to arrive. Section 4. Diagnosing an open fracture. Diagnosing an open fracture usually begins with a physical examination. The doctor will assess the wound, look for signs of a bone fracture, and check for other injuries. X-rays are essential for confirming the diagnosis. X-rays show the location and severity of the fracture and reveal any bone fragments. In some cases, additional imaging tests may be necessary. CT scans provide detailed images of bones and soft tissues. MRI scans help evaluate the extent of soft tissue damage, and angiograms assess blood flow to the injured area. These diagnostic tools help determine the appropriate course of treatment. The severity of the fracture, the presence of infection, and the overall health of the patient all factor into the treatment plan. Section 5. Treatment options and recovery. The primary goal of open fracture treatment is to clean the wound and prevent infection. Surgery is almost always necessary. Surgery allows the surgeon to remove debris and contaminants from the wound, set the broken bone in the correct position, and stabilize the fracture with hardware like plates, screws, or rods. After surgery, antibiotics are crucial to fight off infection. Pain medication helps manage discomfort. The injured limb will be immobilized in a cast or splint, allowing the bone to heal properly. Recovery from an open fracture takes time and patience. Physical therapy plays a vital role in regaining strength, flexibility, and mobility. The therapist will guide you through exercises tailored to your specific needs. Following medical advice, attending therapy sessions, and taking care of your overall health are essential for a successful recovery. Section 6. Preventing open fractures. While not all open fractures are preventable, there are steps we can take to reduce our risk. Practice safe driving habits. Wear seatbelts, follow traffic rules, and avoid distractions. Use caution when working at heights. Wear fall protection equipment and ensure ladder stability. Promote workplace safety. Follow safety protocols and use appropriate protective gear. Wear protective gear during sports. Helmets, pads, and proper footwear can minimize impact. By being mindful of our surroundings, making responsible choices, and prioritizing safety measures, we can significantly reduce the occurrence of these devastating injuries. In conclusion, open fractures are serious injuries that require immediate medical attention. By understanding the causes, symptoms, and treatment options, we can be better prepared to respond to these emergencies and promote healing. Remember, prevention is always the best medicine. By taking steps to reduce our risk and prioritize safety, we can protect ourselves and others from the potentially life-altering consequences of open fractures. UMCC, your ultimate medical consultant connector.